All right, welcome back. You're still watching TV47 Breakfast. While looking at what's happening in our country through the eye of the papers, and we've looked at the state of the country concerning handling coronavirus as a pandemic and issues surrounding it like insecurity and lack of basic amenities like water and soap and very many other things. Alan Abinada Bowino says it's a beautiful morning that the Lord Almighty has been no better way to wake up than with TV47 Breakfast Show held on by Stefan 3 and at Emmanuel 21, at Terror Emmanuel 21. Tony Mirigi says breakfast gang live now, lighting up your morning. Join the conversation that is on Twitter. The hashtag is TV47 Breakfast. Thank you very much. Well, Kidi Moga is asking when he'll be coming on set as well. Well, continue talking to us, and what do you think about the suggestion that the government should now give for free the basic amenities that the country or the citizens need to properly handle or deal with coronavirus? Things like soap, things like water as well. Emmanuel Terrer.
Naam. Corazon, shughuli mingi naamini kwamba tutazungumzia hili, lakini kwanza kuhusiana na swala ambalo tunazungumzia, je, serikali mbona isitoe sabuni kwa vile kuna watu ambao hadi wa sasa najua kwamba hawana nafasi ya kupata maji, hawajui maji yako wapi, na lakini ni kwa sababu serikali iko katika utepetevu fulani. Lakini Facebook kuna moja, sijui kama umpitia hii, lakini kuna bingwa moja anaitwa Sangara Gift Pay, anasema anatutazama na tumeweza. Na mimi hii ni swali ambayo tunafaa tuulize. Anauliza, anaitwa Natty Boy. I am tuned in kutoka Autokiko Pay Nakuru, but T47 pangi inasumbua, lakini na mimi nitashughulikiwa. Lakini swali lake kubwa ni mtu ambaye ameambukizwa corona na akupatie hela, je, unapata vile vile kirusi? Ndio maana na mimi kulikopo na mahali kwamba rais alisema tuhakikishe tunafanya
hela ambazo zina pitishwa kutumia mitambo. The conversation we had with Dr. Brenda yesterday, and we also have a WHO update that is going to cover this terrain, was that the organisms actually land in the hands. They stay long on the hands. And you can actually tell our viewer to go online at TV47K and also on our website www.tv47. We have that conversation that answered all those questions. When you touch, when you come into contact with it from your hand, then you definitely have the organism in your hand. And if you get to interact with any opening that is respiratory on your body, according to Dr. Brenda, then you actually get infected. So, well, it's a very tricky disease, very tricky. And that is why I think the cashless transactions are being encouraged by the government, because if I can simply pay you from my phone, then I don't have to come in contact with the organisms in your hand.
How do these people give you back your, matatu? Ni kitu kimoja ngumu sana kwa razona hapa hasa Nairobi, kwa sababu ya kitu kimoja, yule anashika hii pesa na kupatia hivi, so inakuwa ngumu kidogo, kwa sababu hapana shaka kwamba si kila mtu ana nguvu ya kuwa na hela katika M-Pesa wakati wote. Vile vile kuna swala moja kubwa ambalo tulisema jana kwamba kwepa sana kushika uso, kama tayari umenao mikono yako, kwepa kushika uso wako, vile vile pua lako na macho yako na vile vile masikio, kwa sababu kulingana na mazungumzo ya jana, daktari alisema kwamba ugonjwa huu unapita kupitia membrane. So hiyo ndo ngumu zaidi, kwepa sana kushika, kwa sababu itakupatia nafasi ya kushinda corona kwa sasa.
Today nimepiga picha kwenye akili that this gentleman who all the time to look cool they go, you know passing their hands over their face and passing their tongues.
But ladies also are affected. Naja hii ya kushika nywele.
No, nywele is a different thing. But this gentleman who wants to, rub their hands on their face and then put the tongue out in
but
some.
I've seen this one. Victor normally does that.
Right.
The camera guy anapenda sana akiongea, lazima shike kidogo. Lakini nadhani sijui ni madoido.
Because I think these men think they look a bit sexy when they're passing their hands on the, or they touch they touch the chin and then they touch the nose up in a swaggish kind of way. Man, you guys are in trouble.
So Victor has been madoidoing himself.
Victor does the same. So We do have an update that was given by World Health Organization, and one of the main things that were emphasized within this conversation, dear viewer, is that countries should heavily invest in testing and screening, because according to the particular doctor, the speaking doctor, he says you cannot fight blindly. You cannot blindly fight against an enemy. You need to know how many people are infected and isolate them. Take a look.
Escalation in social distancing measures like closing schools and cancelling sporting events and other gatherings. But we have not seen an urgent enough escalation in testing, isolation and contact tracing, which is the backbone of the response.
Online meeting tomorrow, 17th March, about COVID-19 representative.
The most effective way to prevent infections and save lives is breaking the chains of transmission. And to do that, you must test and isolate. You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
Emergency experts will brief the press on the current situation in the region, and they will be answering journalists' questions.
As the virus moves to low-income countries, we're deeply concerned about the impact it could have among populations with high HIV prevalence or among malnourished children. That's why we're calling on every country and every individual to do everything they can to stop transmission. Test every suspected case. We also ask people to express their solidarity by refraining from hoarding essential items, including medicines. Hoarding can create shortages of medicines and other essential products, which can exacerbate suffering. Tests for those most in need. WHO advised. This is the defining global health crisis of our time. The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity. In that situation, countries should prioritize older patients. This should be everybody's business. Each and every individual should do everything to protect himself or herself and to protect others, and should listen to the advice of the national authorities. So my advice is that this virus will not be stopped without the cooperation of the government, the whole society, and the citizens. Populations with high HIV prevalence or among malnourished children. That's why
we do know that children tend to have more mild infection, have more mild disease, but we have seen children die from this infection. So we can't say universally that it's mild in children. So it is important that we protect children as
all right, definitely. Is taking this as seriously as it should globally, because coronavirus has remained a global pandemic up to now. The good news is, according to the dailies and the news that is coming in, is that the countries of source have managed somehow to decrease or reduce the rates of infection. For instance, China now has closed down one of its health facilities because, while the numbers have gone down, the numbers of new infections have gone down. We also had good news of a woman who was quite elderly, 103 years old, who recovered. That gives hope that against the earlier presumption or earlier discovery or, well, information that was given out that the elderly are dying or have higher chances of not recovering from the pandemic. We also have countries like India that say they have now successfully treated a few cases as well. So there is hope, and that hope simply means that we should continue fighting and being responsible and taking the responsibility responsibility individually as we should. There's also the mention that countries that have highly malnourished children are, vulnerable or more vulnerable. Countries that have higher rates of HIV infections are also vulnerable, but in the end, individual responsibility to each and every one of us. We know that on Saturday, the president has also said that we will be having a national prayer day. If we hold hands together, then we definitely will beat the pandemic. Do continue talking to us. I can see all the response coming in. We're going to be reading all of them at the end or the tail end of the show. Emmanuel Terer is joining us with a medical practitioner to take us through children and vulnerability of children and how to keep them safe and how to manage this now with the children at home. But Emmanuel Terer, I have no idea how possible it is to watch a movie right now. But one thing I know is that Anger IMAX has given open tickets. And I'm assuming then, therefore, that each and every person who wins a ticket will be able to watch this movie even after the pandemic is over.
Nina swali moja. Je, wanaweza fanya online? Waruhusu watu watazame online kwa sababu sasa tayari hatuwezi kwenda kwa katika jumba lile la filamu kwa sababu tutaleta mkusanyiko, na unajua watu wengi wanapenda kutazama filamu sana kwa giza.
Nakwambia kwa giza, na lazima tena muwe wengi, lazima muwe mkaribiana.
Alafu kuna popcorns.
All right, but it is an open ticket, really. It is an open ticket that you get a chance to actually win here from the show. And what do we have for a question today, Manuel Terer?
Nadhani nilikupatia hilo, lakini wacha tu nipeane handles zenye mtu atafanya.
All right.
Kwamba ukitaka kutuma ni #T47KE, #T47breakfast, ndio upate, ukishajibu swali hilo ambalo Corazon najua kunalo, kwa sababu asubuhi ndio kigawana nikajua kwamba umechukua swali lenyewe.
Kabisa, waendelea kunipa majukumu.
Lakini kubwa ambalo nadhani litakuwa rahisi kwao ni kwamba ni nini mtu anapaswa kufanya akishanawa mkono ili kukwepa kirusi cha corona.
All right, and I believe that is the question we have for you this morning. What else besides washing your hands should you do so that you evade or you avoid being a victim of coronavirus? Besides washing your hands, because you've been told wash your hands with soap, osha mikono na kwa sabuni na maji. But what else can you do besides that to actually, evade or prevent finding yourself as a victim of coronavirus, direct victim of coronavirus, direct infection? Talk to us. The SMS line is 22047. You get to win yourself a free ticket, 2 free tickets to watch Anger IMAX. It's an open ticket that you can use even way after this pandemic. And also, you can talk to us online to win the same tickets.
Kupitia Facebook ni TV47 Kenya, Twitter ni @TV47KE. Zungumza nasi, na vile vile nadhani Corazon ndio moja kwa moja ili tupate utathmini wa hali halisi. Anza na #T47KE, alafu vile vile #T47breakfast.
All right, so do tell us, what is it besides washing your hands? What is it that you need to do besides washing your hands so that you keep off or you prevent yourself from getting infected by COVID-19 or coronavirus? #TV47, #TV47breakfast. Tell us that on our SMS line 22047 or online as well. You get to win yourself 2 free tickets, and also with an additional 1,600 shillings only, you get to have 2 large sets of pizza.
And initiate sequence. Tell me, do you remember anything?
Do I know you guys?
I don't think so.
They've been manipulating you.
What you think is real sometimes ain't. And initiate sequence.
Control me forever.
Sure about that? Revenge is what makes a man like you exceptional.
You know nothing about men like me.
That is absolutely fantastic.
I feel like I just heard this. Are they playing this on repeat?
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Hey, Sospita-son, tumefutwa wote.
Yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deeds pay. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikuambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
Mpenzi mtazamaji, asante sana kwa kusalia nasi hapa. Sasa tunazungumzia masuala ya afya, minding your health. Nini inafanyika, lakini siko peke yangu, niko na Edith. Ora, karibu sana Edith. COVID-19 imefika katika taifa la Kenya. Everyone is worried kwamba imeingia na ina tatizo kubwa sana. Lakini I know your segment ni kwamba you need to talk about, tell us much about children. What is happening? What is the risk kwa watoto sasa hivi kuhusiana na COVID? What wanafunga shule, they are going home and they really want to know, when I am home, what am I supposed to do? What am I supposed not to do?
Asante sana. Jambo la kwanza, watoto kuja nyumbani, kwa sehemu kubwa si watoto. Ni shughuli ya wazazi. Because mtoto yeye anangoja kuambiwa instructions. Mwalimu amemwambia endeni nyumbani. Wale wako kwa boarding wameshafunga shule, wamefika labda jana, wanafika leo. Lakini wafika nyumbani, kazi ya mwalimu imeisha. Sasa ni kazi ya mzazi. So to contain coronavirus or just to prevent it is actually a bigger role with the parents. So it's really prevention roles of the parent taking over. Yes.
So that means the attention should be diverted from, the parents should give all attention, almost all attention to their children, because of there is a lot of danger right now concerning the COVID-19. If I do not adhere to this, what happens?
You see, coronavirus behaves like all other viruses. Whether you have a flu or whether you have any other virus, for example, so that the prevention is really by droplet. There has to be a contact. It's not something that develops in you. So the first thing everybody's talking about is about hygiene. And for a child to sustain any hygiene, it's really about the parent. Yes, that's what I'm saying. So the parent is key in this issue about the containing or preventing coronavirus. So your child has come from school, yes. But so what next? Don't assume that the children have been taught by the teachers how to to behave in the house. They have, first of all, you need your own housekeeping. When your house is clean, first of all, that is key, because then, like any other droplet infection, that if someone sneezes onto a bed or onto clothing, you know that the virus stays about 9 hours. So how the house is made, if it's spacious, well ventilated, there are no stacked newspapers and old exercise books that have been there for the last 30 years.
But you know children can do anything.
So now, that's what I'm saying, if first of all the house is in order, it's easier for you now to tell them, now this is what you'll do.
So as a parent, you need to give a certain arrangement to avoid a lot of
Yes.
mishaps ambazo zinaweza tokea. There's another question that I would want to know. Is there any way that we can curb so fast compared to first you sit down and explain to them, but you need to have set some rules more than explaining to them?
Yeah, you need to have, it's really about your lifestyle, because coronavirus is bringing people to uncharted waters. People are just suddenly wanting to live a lifestyle they've never lived. So if you don't practice a certain level of hygiene or certain rules in your house, it's trying to push into children. Children, you know, they listen and they look at what you do more than what you tell them.
During my research, I realized that you have some tips on how to make sure that this is not spreading faster.
Yes. Thank you. That's what I'm saying. Number one is let's be calm about it. The panic is even making people more sick. Two, just ensure on hygiene.
You talk of that being calm. You know, the way the message is relayed also is making us panic in a way. So what do you tell someone who is in a panic mode?
That's what I'm saying. Just be calm. Know that one thing, that everything that has a beginning has an end. And because it's a pandemic, it's global. You've seen that some people, even in China, Wuhan, where it began, some survived, some didn't get infected, some got infected. That means that even us, we are able to go through the three categories. Either you get infected and you survive, or you get infected or you die, or you don't even get it. So that's what I'm saying. The first thing is that as a parent, also show by example. Keep your house clean. Remove all the unnecessary dust. Don't let, you know, we are so used to having damp clothes in the house or dirty clothes in the house. So just make your house as more ventilated as possible, and then now show the children that there's a technique of washing your hands.
Okay.
Yes.
Before you move to the next tip, there's something that you mentioned about this pandemic, that it can cause death, or it can be affected and die, you get healed, and then now you also might not even get the disease. So there's someone who would want to know much about that.
It's really about immunity. You remember when you look at the announcements, why even I decided to put up the points about children is because we are just telling people that COVID-19 is dangerous to the over 60, over 80. And I'm wondering, if you're talking about the elderly, what about the young children? Because their immunity is still low. Just like when you're much elderly, your immunity is lower. So even them, they are younger. That's why some of them will not get. So even in the general population, then there are people who have a strong immunity, and there are people who have been weakening. That's what they're saying. If you have another underlying problem, then it's easy for you to find yourself infected. Just the way in an ordinary flu, we can be in the same vehicle and somebody's coughing there, somebody's sneezing there. 3 people will be infected, and even maybe the person sitting next might not even get it. So it's really about immunity.
Is there a way that you can improve the immunity of a weak baby?
With baby? Yes. Remember, we have a system in place, like the immunization schedules that are there. If you have a child that's still under immunization schedule, let them continue the immunization schedules. Already in the schedule, we have every 6 months, a child goes back for vitamin A, which takes from month 6 up to 59 months. That is 5 years. So you see, these are things that strengthen the immunity, because the body cannot contain so much that kind of vitamin A. So that you have to give a supplementary. So they are given a supplement of vitamin A, which helps the body to be able to it boosts the immunity. So if a child has already been getting this, every 6 months they've been getting this, or is still in the process, kindly continue doing that. And let the child continue getting the normal vaccination, the immunization schedule.
So that runs for
so it works for
from
children.
A certain age to which age?
if you already had been, if you finished you completed your immunization schedule, you don't need to worry much.
Okay. So, but sometimes you find someone who is beyond the immunization schedule, but they're still weak. So is there a way also that we can help? Because I know everyone is worried this COVID is attacking someone who has weak immunity.
Yeah, remember that we need to eat very well. So the children need to be given a balanced diet as much as possible. I say as much as possible because many times what do you give children? Maybe give them tea and bread, you give them sauce, maybe chips, you give them things that look like they feel easily, they are satiety, but they are not nutritious enough. This is the time that the body needs to have food that is able to combat any infections. And vitamins and vegetables and fruits are very good in this. So let them have a lot of vegetables, let them have a lot of fresh fruits, and let them have a balanced diet. And accompanying that, also have a lot of water.
So that will build the best side of the immunity. So now you have the second tip that we were supposed to move into, but also I interrupted by asking a lot of questions in between. But now give us the second tip on how to curb this one.
To curb?
The COVID. You explained the first one, that you need to wash your hands as a child and show that you have this one. Now we have the second tip that you have to mention and tell us how we are going to follow it.
Okay. And then there's this, what is giving people panic is really getting other infections. And sometimes someone can just get a flu. So I tell parents, if there's any infection, any illness, kindly just let the child have immediate attention. Let the child take the child to the hospital so the child is examined immediately. And another thing that also parents need to know, that this child, if you contain a child or anybody seated this way, then the body is not able to exercise. And that's also messes up with immunity. So allow the children to also just play. When they play, they're able to exercise.
It's really easy.
Yes. Remember, the good thing, serikali imeshapena nini? Curriculum. They already have their syllabus that's already been downloaded. So they'll play.
Paranoid.
So they'll play, they'll have a little time for play, they'll have little time to do their assignments. So even if they're not playing in a big mob outside, but allow them to jump in the house, let them play out the corridor. So long as they are not playing in big crowds, just allow your children to be children. Yes.
So what are the guidelines ya kumwambia mtoto ajifunze kusneeze? Because I know ni watoto wadogo, so wanaweza sneeze anyhow bila kujali kwamba labda anaweza sambaza labda pengine kirusi kama konacho kwa mwenzake. So tufanyaje kwa mtoto?
Utamfunza mtoto kusneeze kwa mkono uliokunjwa. Utasneeze hivyo hatio, ama utakoholea hapo, ama utafanya nini? Utampatia either tissue, anajifunza kukoholea kwa tissue. So wewe ndio maana nimesema mzazi akiwa kama kielelezo chema, ni rahisi sana mtoto kujua hivi ndivyo mtu anafanya. Kwa hivyo wakionyeshwa hiyo njia ya kuweza kupiga chafya, ni rahisi sana kwa hao kufuata, na kila mara mwambie. Alafu jambo moja ni kwamba tumesema social distances. Hata kwa nyumba mwambie hatutasalamiana. Tutasalimiana labda kutumia elbow, si ndio? So wewe kama mzazi unapofanya hizo mifano za program unamwambia kwamba tusalimiane hivi, kama ni kusneeze unasneeze hapa.
Niliona jana that you can also do this, salamu, then tumia kiwiko, that's elbow, and then chobea ni kugongana, tumia
kung fu.
Hiyo ni chobea. Na vile I guess kuna moja pia salute
na pia
vile miguu, niliona jana kufanya miguu. So watoto wafunzwe pia. Na kuna moja nadhani kila mtu watu wengi wanaogopa kufanya, lakini naona ni mzuri kwamba mtu akija kukusalimia ingiza mkono kwa mfuko, atagundua kwamba hutaki kumsalimia, lakini si madharau. It's because that you only trying to evade the fact that you can be infected. So for children, how long are you supposed to be keen on them to teach them these tactics and to realize that they should maintain?
Practice. So do with them. If it's hand washing, go with them. Not everybody has access to running water, but you can have the leaky taps. But whatever source of water, let the children apply soap. Avail a lot of soap and water. Let them rub their hands. You know, as they start rubbing their hands, they start counting 1 up to 20. They're very good in that. Okay. So they'll rub their hands. So it's a lesson that you have to inculcate in them that every time you're washing your hands, you're counting. Just the way you tell them to count up to 20 when they're brushing their teeth is is a way of calculating the measuring time.
So you're making it fun instead.
Yes, making it fun, so it's not looking like it's hard. Okay. So they'll be washing, they'll be rubbing over and going under the nails and repeating again. So that way, as they start rinsing, by the time the procedure is done, they won't even notice it's already even 30 seconds. Okay. It's fun. So make it fun, make it available. Don't say that it's you can only wash every 1 hour. And then another thing that we need to realize, it is the hands. Sometimes even the thing that makes us infect one another is because you're either sneezing to people or our own hands are transporting it. So there are people who have hands all over. So we're teaching our children this season that actually now we're going to change our lifestyle. Okay. There's no point shika uso kila saa kwa macho, kwa mapua, kwa mdomo. So actually, like when people are using gloves, it's really a way to just make the brain realize that there's a barrier. I'm not touching my mouth.
So pia kwa watoto naamini kwamba itakuwa ni vema kwao ukiambiwa kwamba when you're done washing your hands, you also avoid touching your eyes, your nose and the ears at the same time, because you're going to infect yourself.
It will be hard the first day, the second day, but that's what I'm saying. It's really a model thing. The parents should do it. The children should do it. And tell your children to kumbushane. Nikifanya makosa nikishika uso nioneshe. So with that it becomes
make it fun.
Yes, make it fun.
Kama mchezo kwa watoto, because at the end of the day you're going to help them avoid these infections. Yes. There's another question. Someone is young, the baby's maybe 7 months or 6 months, and kuna mtoto mwingine anataka kumbeba. Huyu ni first born, akona 4 years, anajua kubeba mtoto. So what happens umetoka and then haujui kwamba alienda kushika mtoto mwenzake?
Kitu kikubwa ni kwamba usafi. Kama unajua, we are assuming that kwa hii nyumba hakuna mtu akona COVID, but tunajifunza, tunalea watoto wetu kuwa na hiyo behavior ya non-touch. So unajua kwamba hata mtoto mdogo pia anaoshwa mikono, unamosha mikono kila mara. Kwa sababu kama hauna maji, ukiwa kwa nyumba maji na sabuni inatosha. Tukiwa nje unaweza kutumia sanitizer. Yes, sasa kama kuna hiyo mtoto kabla hajanyonyeshwa ananawishwa mikono, hata kama haguzi chochote. Sasa huyu mdogo huyu mkubwa atajua sijanawa mkono, bebe hajanawishwa mkono. So itakuwa ni kama kitu ambayo tumezoea kwa nyumba. Akitaka kumshika mtoto atanawa mikono, alafu akuja shike baby. Sasa kila mmoja akifanya inakuwa ila mzaha, lakini pia ni
fun at the same time.
Yes.
This baby also have the young people would want to go for the natural call. There's a long call and the short call. So what do you tell them after that? You're done with your short call or long call. So what happens?
So even when you come from the loo, always wash your hands. The same procedure. They clean up themselves, they wash their hands. Let it just be, before I do something, I wash my hands. So that you'll find that it's even more than 1 hourly, because it just depends. Because they'll start enjoying. Yes. And then another thing is just involving the children also in cleaning of the services. They know that, tell them, if someone sneezes here, the germs are there. So they'll be saying, we've not cleaned our house.
Are we in any way instilling fear?
No. Because you're talking this at the point of joy. You're not saying it's COVID, but you're also just putting it as healthy practices that will go a long way. The things that happen in a problem like this, but eventually they change how we operate.
But if there's this scenario, a young child telling a friend that you're sneezing ukona COVID, do you think there'll be a certain stigma between the children?
It's really about adults around children.
Okay.
Yeah. If you tell children that coughing doesn't necessarily mean that you have COVID, yeah, because teach them that besides just coughing and sneezing, you have had to have traveled out of the country or been in contact with somebody who has traveled or been in contact with somebody who has been confirmed to have the COVID-19 virus. So really, let's make it very clear that you're doing this as a practice. Yes.
So because of time, I want you to give us the last part of it. This person is pregnant, and she's pregnant, and she doesn't know how to deal with this incoming pandemic.
Just like the children, where we're saying there's no much research that has been done, so also with the pregnant moms. There's nothing much that has been done on COVID-19 and pregnancy. But we know that in this week, actually, from the 16th, we were able to ascertain from the researchers that are teaching globally that the women that gave birth in Wuhan, China, in the January, February, March, their children are actually doing well. So that is really a hope. So I think let's not panic, because what happens when you're expectant, your child is able to communicate with you. If you're panicking, the child also gets stressed, and the child is wondering, sasa nikitoka itakuwa aje? Unaona? So the moms, if you're expectant, you need to be very, very calm and just let go. Just do your best things that you know best. Because in a normal pregnancy, in an ordinary time, we tell moms to be very hygienic. Now in COVID is even now more. So the issue is just you're intensifying, you're just improving it more. When there's no COVID, we tell expectant moms, don't travel unnecessarily. There are flights that don't take people at 36 weeks. Okay. So even now, we're just making it a little bit strained and telling them, don't go out unnecessarily. If you really don't need to be in a group, why are you going there? Don't mingle if you really don't have to go. We're telling moms, now be more careful, now be more proactive, and just decide, I will sneeze the right way, I'll cough the right way. Just the way when a mom is expectant, a slightest cough or a slightest infection, they run to hospital. Even in COVID, that will be the same thing. Be seen early if you're not feeling well.
Okay, the spouse at this time is close to the pregnant mom, and maybe, say, unfortunately, ametoka nje akapanda matatu, and then akirudi akasahau kwamba alikuwa ametoka nje. What is it that you should do first to realize kwamba my spouse went out, and then aliporudi hakunawa mikono, and then we've had a one-on-one touch as pregnant mom?
I believe in being calm. You know, when you're expectant, you're very hypersensitive. And when someone is expectant, then you just snap at them. You didn't wash your hands. It goes a long way. Small little things go a long way, because the emotions are heightened because of the hormones. So I think even spouses and children, you said, even with the children, let's remind each other. Make it a habit. A game. Umena mkono, so that it's really provided for at the door. We are putting sanitizers at the door, even on the inside. So if someone walks in, it will be a visual thing to see. You're not leaving the door to go all the way 3 rooms to the bathroom. Have something there, sanitize the hands, and then move in.
Kwa sababu nadhani watoto watasahau, so inafaa kama uweke karibu sana. But there's this person also ambaye najua una picture nyumba ambaye iko na maji ndani, but there's one ambaye ana maji anatafuta, na watoto ndio watatuma kutafuta maji. So there should be a way that we can tell them how to go look for water.
Unakumbuka nimesema kwamba kama hauna tap water, kuwa na leaky tap. Ile ndoo ambayo imetobolewa hapo kando, alafu inatirika pole pole. Weka tu kwa nyumba. It's for a season. Nakwambia kuna mambo ambayo COVID imeleta ambayo itakuwa lasting impression. Tutakuwa tunafanya kila siku. Na alafu utakuwa na either spirit wipes hizo ama sanitizers ziko pale. Mimi kitu moja na shabikia tu ni kukuwa na sabuni na maji.
Okay. So sabuni aina gani? Yote ile isikuwe.
Sabuni ni sabuni.
Okay.
So, kwa sababu tukiweka pressure kwa watu sanitizers, alafu najiuliza watu wangapi wanaweza ku afford sanitizers? People are struggling to even bring food on the table. You're telling them about sanitizer, they will laugh it off, because they even want to say, let it even come so that we die. So we want to instill hope in people, instill hope in the expectant moms, that you can do the right things and still make it.
Na kwa watoto ambao labda pengine mama yao ama baba anatazama runinga TV47 sasa hivi, na umfunze kwa njia moja jinsi ya kusalimiana. Kuna moja nimeona jana wafanya hivi, vile vile moja kutumia kiwiko au elbow kwa wale ambao wanafanya, ama vile vile kuchobea, wanagongana. Najua watoto watapenda hiyo kugongana, nyuma kidogo unapiga, inaitwa chobea. Sasa utasaidia mtoto afanye hivyo. Na vile vile kuna moja hii, najua hii itakuwa mchezo kwa watoto, hii kucheza kupiga teke mwenzake, ni salamu kivyake. Na vile vile ukiona mwenzako anakuja kwa kasi anataka kukusalimia, na wewe mtoto mdogo, engeza mikono yako kwa mfuko na mwambie kwamba tumeambiwa kwamba tusisalimiane. Na kuna moja wampitisha mikono hapa sasa hivi, ndo itakusaidia. Mpenzi mtazamaji, asante sana kwa kuendelea kutazama runinga TV47. Huyo ni Ora, lakini neno la mwisho kabisa najua ungependa kupitisha mzazi na vile vile mtoto.
Jambo la mwisho nasema kwamba wazazi wakue marafiki na watoto wao kwa muda huu, na kama wewe ni mama ambao unatarajia kupata mtoto, kuwa na hekima. Kuwa na hekima wakati huu, weka pesa kwa M-Pesa, tafuta hospitali mapema, jua pale ambapo utaenda, fanya shopping yako mapema. Usiseme kwamba baby shower itakuwa, tukienda total lockdown, hakuna wageni watakubaliwa kukuja na hakuna kutembea kutakuwa nje. Tunatazamia kwamba itakuwa jambo jema. Yes, we're expecting for the best, but always just preparing for the worst. So be wise and just be ready for it all.
Asante sana mpenzi mtazamaji, na shukuru sana kwa wewe kusalia nasi tangu tuanze asubuhi hadi wa sasa. Endelea kutazama runinga TV 47. Umekuwa na mimi Emmanuel Terere na vile vile mwenzangu Corazon Sefan. Kupitia Facebook umewasiliana nasi, kupitia SMS vile vile umewasiliana nasi, na wengine pia kufuatilia bila kuchangia, lakini umekuwa shabiki mzuri. Joash Onsare ambaye pia ni shabiki mkubwa wa ndizi atakuja ikifika saa 4. Lakini mpenzi mtazamaji, usikwende popote, majaliwa Mwenyezi Mungu. Runinga TV 47 ipo hapo, mimi na ajili yako. Edith Ora, nashukuru sana kwa kuja kwako. Kwa wale wote waliofanikisha makala haya, akiwemo mwelekezi mkubwa wa Mboi Gitao, nasema asante sana. Wapiga picha Victor vile vile na Kedo, nashukuru Mwenyezi Mungu mkubwa. Vile vile shughuli ya kuhakikisha mashine zinakwenda sawa Pato, sema asante sana. Maganga vile vile Omosh mwenyewe kwa graphics, nashukuru sana. Naondoka kwa sasa, jina langu ni Emmanuel Terere.